Dr. Shenoy, under these circumstances, and as Dr. Gupta is pointing out, that chances of contamination are most high during manufacturing, then is clearly the pharmaceutical company then responsible?
Well, that is correct to a large extent, that the responsibility goes back to the manufacturer, but then there is a whole chain there. So we cannot comment on this till we understand specifically where the lacunae were.
Sure.
But to be honest with you, I would like to actually talk about a couple of other things which are really more relevant. You see, we run a company which exports services from India to Africa, CIS countries, and we are also, having partners in the US. And for us, in the last few years, we are facing a very peculiar problem where we find that Indian drugs are losing their credibility. So when we say that we will supply you meds from India, the receiving countries have started looking at us with a lot of skepticism. They say that, it's going to be poor quality. Now that to me is a major hit, because as it is, we are struggling on our credibility. I mean, even, I don't want to say something negative about any country, but we are managing one of the a hospital, one of the largest private hospitals in an East African country, and this is our hospital, right? And they are importing medicines from Turkey. Now, when I said that we can get you more effective and more cheaper alternatives from India, they said, no, the public does not have faith in Indian pharma. Now, that is, that hurt us. And and ironically, Turkey manufactures medicines in India. So we manufacture for Turkey, and then Turkey gives them to these countries. So it's a serious issue, and instead of pointing fingers at each other, I think we need to identify where the problems are. And if you would like me to elaborate a little bit on that, if I have time, I'd like to do that.
Sure. Dr. Shenoy, with certain points that you wanted to highlight here, please go ahead.
Yeah, thank you. So from the industry's perspective, I see a lot of damage that we will undergo. We are already undergoing that, which is really sad. Now, the second thing is, where is the fault and all that? Basically, the issue is at enforcement. It's not that we don't have regulation. We have the laws, and it's a problem that we are all aware of, whether it's in the government or whether it's at the enforcement level. The issue is ground level enforcement, which is really the loose area. So I don't want to talk too much about what we are talking about in terms of enforcement, but I think my listeners and your listeners can understand when I say that enforcement, the inspector, that is the issue. It's not proper. Number two, at the regulation level, if you want to talk about that, then we have this huge monolith called the CDSCO. Now, if you look at the CDSCO, we have been saying that this is too big. You have to break CDSCO into different parts, because today, they are responsible for all the meds. Then they're responsible for, the consumables, and also for things like, if you want to, let's say, if you want to import or export or sell, let's say, a glucometer. The glucometer is okay, but when you talk about the strips, which test your sugar, that comes under the Drugs Act. Now, that's an absurd thing, right? So we have been telling the government, and there has been a lot of talk around that please break CDSCO into different parts, and this area is to be enforced, because there is a lot of protectionism at the top, and only the government can actually break it and say, okay, if you want to really enforce this on the ground properly, then you need to break this monolith into smaller pieces, which are then easier to control. Yeah,
All right. Many suggestions there that have come from you, suggestions that surely need to be looked into by the government. Many thanks, Dr. Shenoy, and to Dr. Gupta for joining us here on this discussion.
Thank you.